I recommend Winship Cancer Institute to people that come up and want to share their story with me. I always tell them you've got to get to Winship.
We are the only National Cancer Institute designated cancer center in the state of Georgia. We're the only center with that distinction.
And that means that the National Cancer Institute has come and put Emory through a very rigorous test of our facilities, of the people that work here, and the programs that are going on here.
What we've really done over the past decade or so is to also recruit the very best people from across the country and across the world who will be specialists in both research and care of every type of cancer.
I chose to come here because there was a certain feeling of energy and excitement, and that's borne out in this NCI designation in the last couple of years.
Dr. Coe is a wonderful person. He lets you ask the questions, so he tells you what you want to know. You know, how much do you want to know?
So when a patient sees a Emory physician at the Winship Cancer Institute for a given type of cancer, he or she might have 10 or 20 specialists behind them, giving them the depth in both research and clinical expertise to help guide the management of that one person.
I was talking to my mother about this last night, and she was so excited. She said, "Cindy, this is just perfect for you because they've done miracles for you." And they have. They've provided me a new life.
I think it's very invigorating to a patient. I think they become very excited, especially in a clinical trial, understanding that they're in a trial where they're going to at least get the standard of therapy, but they may be getting something better, and they may be part of history making.
It helps very much in getting additional funding to Emory that helps fuel the research that ultimately will get into the clinical care and into the general population.
The clinical trial that became available in March of '09 was what I'm currently on, and it's called HULAC 63. I have been very successful in phase 1, absolutely no side effects. Winship Cancer Institute is one of only 4 hospitals in the world who is allowed to have a phase 1 trial for this drug.
So there's no one patient plan for all cancer patients, even with a given diagnosis. And that's really the value of having the depth of expertise across all the specialties in a given cancer here.
From a patient's perspective, they have more options here than, say, someplace that's not NCI designated.
I am here talking to you because I am the cure. I really believe that I am the cure.
The NCI status adds another level to what was already, in my eyes, a perfect place to go.
The preceding program is copyrighted by the Winship Cancer Institute of Emory University, a National Cancer Institute designated center.